This is an introduction to Plaquenil, hydroxychloroquine, in use in autoimmune disease. My name is Barbara Grubbs, and I am an autoimmune disease warrior, or Spoonie. I'm also a licensed nurse practitioner. Today I want to talk to you about Plaquenil. Today I wanted to give you some information on Plaquenil because it's used in many autoimmune conditions and I've been on it for years. But please know that this is not intended as personal medical advice, and you should always consult your specific qualified healthcare practitioner for any decisions on your medical management. My goal in providing you this information is to share my individual experience with Plaquenil and what I've learned about it from others who take it. I have a lot more information on seekingspoons.com, so please go there for a more comprehensive review. Also, if you are a Spoonie, you should check out spoonmeter.com. There I have an awesome 1 to 5 spoon tool that is awesome for communicating how we are feeling. The goal is to have as many 5 spoon days as possible, so you will commonly hear me telling you, I hope you have a 5 spoon day. Now, Plaquenil was originally developed in the 1940s, and it was used as an antimalarial drug. That's to treat or prevent malaria, which is spread by mosquitoes and can cause fever, chills, and a flu-like illness. So you may still hear Plaquenil being referred to as an antimalarial drug, but nowadays it's more often used for autoimmune conditions, especially the connective tissue diseases such as lupus, RA, Sjogren syndrome, and scleroderma. It's also used for certain other inflammatory and dermatological conditions, so many people are on it. Plaquenil belongs to a class of medications known as DMARDs. That's DMARDs, and it stands for Disease Modifying Anti-Rheumatic Drugs. They are considered disease modifying because studies have indicated that they can reduce pain, swelling, and joint damage and reduce the severity of long-term disability related to some of these diseases. Plaquenil seems to be a good drug to start when first diagnosed with inflammatory connective tissue disease, and one that many people will probably stay on for continued disease management. It won't stop the disease from progressing, but it should help slow it down. It also seems to be good at restraining the immune system without increasing your odds for infection. That's a strong plus for Plaquenil. Many drugs that work on the immune system also weaken it and substantially increase your risk for infection. Plaquenil is a slow-acting drug. It can take up to 6 months to reach full effectiveness. However, most people do notice some improvement after about 2 months of therapy. It's thought to suppress the overly active immune responses that occur with autoimmune conditions, but no one seems to be sure how it does this. I found a long list of symptoms that Plaquenil has been associated with relieving, but let me just sum them up for you by saying that Plaquenil can help reduce the incidence and severity of symptoms related to the autoimmune disease condition that it's treating. Many people find that it helps with pain and joint mobility specifically. In fact, a number of people told me that they did not realize just how much Plaquenil was helping until they had to come off of it for some reason or another, and all of their symptoms and pain returned or worsened. That's all I'm going to share in this video, but if you are on or considering Plaquenil, please go to seekingspoons.com for more very important information that you need to know about it. Also, if you are a Spoonie, then head on over to Facebook and look for our private Seeking Spoons support group. Until next time, I wish you all 5 spoon days.